Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper left 5 and the lower left 6. Both of them have periapical radiolucencies with cortical plate perforations. Here we can see it on the upper left 5, and we can also see it with the mesial root of the lower left 6. Now on the this is the panoramic view. We can see a big periapical radiolucency, and we can also see radiolucencies here. We're going to take you to the transaxial view, which is the proximal view. On the proximal view, we can very clearly see that there is a cystic lesion, which is also showing a slight haziness. So we're presuming this is fluid filled as well. It is not perforating the sinus yet, but we can also see that it is pushing the floor of the sinus, which is why it could be cystic in nature. We can also see that there is a cortical plate perforation here as well. As we are moving towards the distal aspect, we can see that this cystic lesion or this radiolucency is also damaging the bone in this region. So this is quite a big radiolucency. This is when the upper left 6 starts and the radiolucency starts to dial down, and here we can see that the cortical plate of the upper maxillary bone is actually coming back to its normal. So here the maxillary bone cortical plate is also lost. We can see that the Schneiderian membrane is intact, but the cortical plate is definitely raised in the upper left 5. Now moving to the lower left 6 region. The lower left 6 region, we've got a endodontically treated tooth as well. This is the distal root. The distal root has a periapical radiolucency. This has a restoration of a crown as well. Moving to the mesial root, however, is quite significantly affected as well. There we go. This is the mesial root. So the mesial root has a periapical radiolucency as well, and this radiolucency is actually perforating the cortical plate as well. But we don't see any pathological lesions such as a cystic lesion. This could be a very small periapical cyst, but most likely a periapical granuloma is suspected in such a case. The bone quality on the lingual side is quite adequate, so a extraction followed by grafting will be advised and indicated in such a case prior to implant placement, whereas in the upper left 5, extraction followed by enucleation and complete removal of all the contents is advised prior to grafting and implant placement. This is the axial section. On the axial section, you can see this is the upper left region. This is the 5. We're suspecting a crack here as well, and this can be seen when we zoom in. And so this is a cracked tooth, could be a cracked tooth as well. And as we are moving further down, so this is the cystic lesion. It starts right here, and here you can see that it is perforating the cortical plate. And this is the sinus on the right hand side. This is the sinus, and this is that cystic lesion. As you can see, it is at the floor of the sinus as well. So this needs to be carefully examined clinically as well. Thank you very much.